Thank you all. And it's the time to start the international session. Today is the 1716th day of international session of IFPH. Today, our speaker is Dr. KANEEZ FATMA ZEHRA from Visakhapatnam, Andhra Pradesh. She is a consultant at Dr. Basil's Homeopathic Hospital. And today's topic of discussion is inflammatory bowel disease and the gut-brain immune axis, a homeopathic insight into chronic inflammation. Let's start the session. I am welcoming Dr. KANEEZ FATMA ZEHRA to the session, and I welcome you all for the session.
Thank you so much, sir. Good evening, everyone. I am Dr. KANEEZ FATMA ZEHRA, and this is truly an honor and privilege to present my topic in front of you. I have seen everyone are here so much experienced doctors. I am just a budding doctor. So I would like to start my presentation. So please forgive me if I make any mistake. Can I share my screen, sir?
Yeah, you can. It happens. Slowly you, yeah. It's now
Yeah.
okay.
Yes, sir.
No, it got minimized. Yeah, it's now
Okay.
visible.
Okay.
And you are audible.
Okay, sir. Thank you. This was my first time. That's why I got confused. Can I start, sir?
Yeah, sure.
So today I'm presenting the topic inflammatory bowel disease and the gut-brain immune axis. Um, this topic is very close to my heart and crucial for today's modern healthcare. And this inflammatory bowel disease and the gut-brain immune axis today will explore how homeopathy can intelligently interact with this complex network to offer sustainable healing. So, why I chose this topic because IBD is no longer rare. It's rising dramatically and affects both physical and mental well-being. Conventional approaches often overlook the dynamic interplay between the gut and the brain and the immune system, and this is where homeopathy can shine through holistic understanding. And my objectives of this webinar are my goal today is to first understand the pathology of IBD, then we'll dive into the fascinating gut brain immune axis and how the mind, gut, and immune system are all interlinked. And finally, we'll uncover how homeopathy, with its personalized approach, can intervene intelligently and gently. So, what is IBD? This in inflammatory bowel disease, it includes two chronic conditions, which are ulcerative colitis and Crohn's disease, and both involve inflammation of the digestive tract, often causing diarrhea, pain, weight loss, and fatigue. It's a lifelong condition with flares and remissions, uh, and its impact goes far beyond and the gut, and it affects confidence, mental health, and the quality of life. And the pathophysiology of IBD. Uh, this IBD is driven by an abnormal immune response to harmless bacteria in the gut. Think of the immune system attacking friendly neighbors by mistake. And the genetic factors, environmental triggers like diet and stress, and disrupted gut flora all contribute in this. And the intestinal lining gets damaged which should fuel the chronic inflammation. So while this abnormal immune response happens, the intestinal lining gets damaged while fueling the chronic inflammation. And here's the gut brain axis. The gut and the brain and the immune axis is a complex three-way communication network between the gut, the brain, and the immune system. It explains how these three systems constantly interact and influence each other, playing a crucial role in maintaining health and contributing the chronic diseases when they get imbalanced. So, first, I would like to explain about how gut and the brain connects. This is the bidirectional communication between the gut and the brain. It involves neural pathways, especially the vagus nerve, a direct highway between the gut and the brain. And the neurotransmitters like serotonin, 90% of which this serotonin is made in the gut, and the hormones and microbial signals it passes through the vagus nerve to the brain. So, whenever a person feels, for example, if a person or a student, if he has an exam or any kind of stage fear, he will get a little tensed or stressed. At that time he will feel like rushing to the washroom. So uh, due to the mental stress or tension, the signals are passing to the intestine. Like that, the gut and the brain are interlinked. And the gut immune axis, how the gut is interlinked to the immunity. So the gut is the home to 70 to 80% of body's immune cells. As we all know, as they all say, like the brain, after the brain, our gut is the second brain. And in this gut, 70 to 80% of the body's immune cells are formed. And the gut bacteria, which is called microbiota, are trained and regulated in the for the immune system. A healthy microbiome promotes immune tolerance and imbalance can, and this imbalance can trigger inflammation and autoimmunity. So now comes the brain and the immune axis. The brain influences the immune system through stress hormones like cortisol, which in some of the autoimmune diseases like PCOD and all, the cortisol levels are noted very high. So it controls their mood swings and all. And chronic stress can suppress immunity or lead to immune dysregulation. And inflammation in the body, especially from the gut, in Crohn's disease or ulcerative colitis, this can signal the brain and affect the person's mood, cognition, and behavior. So, the gut influences the brain through microbiota and neurotransmitters and the vagus nerve, as you can see in the picture. The immune system responds to gut health and brain stress signals. So, chronic inflammation or dysbiosis in the gut can lead to mental health issues, autoimmune diseases, and or neurological dysfunction. This axis is especially important in conditions like IBD, IBS, depression, anxiety, autoimmune diseases, and some neurodevelopmental disorders like autism. Now, the psychoneuroimmunology in IBD. This helps us to understand how our emotions, nervous system, and immune response are deeply linked. Anxiety and stress are not just emotional states, they can trigger immune responses. This is crucial in IBD, where mental health and gut inflammation often rise and fall together. So, these are some of the evidence based studies which explored homeopathy's potential to modulate gut inflammation and psychological stress in IBD patients, and it is a very exciting step forward for us. And here comes the homeopathic approach. Um, In homeopathy, we view the patients as a whole. Two patients with identical bowel symptoms can receive different kind of complete different remedies based on their mental states, stress responses, and physical constitution. This is the beauty and depth of individualized medicine. So, homeopathy helps in balancing the gut brain immune axis by working holistically and targeting the root cause of imbalance, where it's emotional stress, immune dysregulation, or gut dysfunctions we can see. Here we can see how it works. So first, the modulating the immune system means immunoregulation. Here, what happens? Our homeopathic remedies strengthen the immune response rather than suppressing it. In autoimmune or inflammatory conditions like ulcerative colitis or eczema, remedies like Merck or Nux vomica or sulfur help modulate the immune system very gently. And second, restoring gut health. Remedies act on the gut mucosa, flora balance, and digestive function. Like in Nux vomica, for gut hypersensitivity due to stress or over medication, Lycopodium for IBD like symptoms with bloating and anxiety, Podophyllum or Allosocotrina for colitis and diarrhea with gut inflammation. And the third one, balancing the emotional mental sphere. Homeopathy sees stress, grief, or emotional trauma as key disease triggers. Remedies like Ignitia, Natriumur, Sepia addresses psychosomatic links in gut-brain disorders. Emotional healing reduces stress, induced immune and gut dysfunctions. And the fourth, microbiota support and detox. Homeopathic detox and drainage remedies like Berberis vulgaris and Chelidonium, carcinosin, these support liver, lymphatic system, and gut flora, aiding the body in eliminating toxins and restoring microbiome balance. So, and the final one, individualization. The constitutional remedy matches the person's physical symptoms, mental state, and predispositions by supporting systemic balance across the axis. Um, Here, I want to share a case in which I have seen a female patient of 21 years with chronic ulcerative colitis, a third grade pancolitis, in which she had symptoms like bloody diarrhea, anxiety, loss of appetite, fatigue, and weight loss. So I prescribed her Merck or 1M, which was her constitutional remedy, and I got the result within 4 months. She was all symptom free. Here I want to correlate her case, like I will show you the gut, brain, and the immune point of views. So, how this girl's gut, brain, and immune axis is linked throughout her case, and how homeopathy helped her, and how, with the help of homeopathy and the gut, brain, immune axis pattern, I have treated her, and now she is very healthy. So this first one is the point of view through her gut. She had unhealthy food habits. She skips breakfast daily, and she used to drink she used to drink tea empty stomach, and she loves to eat fast foods and mostly fried food, and always wants to drink cold water and cold beverages. The symptoms she have got since the starting of her flare up of her ulcerative colitis. She had severe abdominal colic, and she doesn't allow to touch during the examination also. And she had bloating, belching, and flatulence moving inside her abdomen. She used to tell like she can feel the gases are moving throughout her abdomen, and she had twisting and twitching and pulling type of pain in her upper quadrants of abdomen, and she has urge to stool soon after eating something. Even she eats or drinks anything, she have to rush to the washroom. And she had bloody diarrhea 12 times a day, and burning in rectum and anus, and with stools which are dark and blackish in color and full of mucus and blood. And I have another point I want to add here is she was very weak and very lean. She has lost lot of weight. Now comes the point of view through her brain, her mental symptoms. She is very anxious, and mostly during night times her anxiety levels increases, and she had insomnia, due to her anxiety and thoughts. She can't able to sleep, and she had confusion also. She can't able to decide something or take any decision and can't able to concentrate. Next, she had fear of everything and stress, depression, and mostly she had dreams of murders, dead bodies, snakes, and someone chasing her. And she had fear of getting hurt, and she was very introverted. And here comes the point of view through immunity. So by seeing her gut and the brain points, here we can correlate how her immunity got affected because of the imbalance happened in her gut and the brain. By skipping breakfast, it weakens her daily immune resilience. By drinking tea on an empty stomach, which disrupted her gut immune balance, and regular intake of fried and fast food suppressed her immune function, and cold water and beverages lowered her digestive fire and affected gut immunity. So, chronic abdominal inflammation, which reduced her mucosal immune protection, and frequent bloody diarrhea, which led to immune exhaustion, and her night anxiety and insomnia, which lowered her immune recovery, and the constant fear and stress suppressed the body's natural immune defense. So, after analyzing her whole case, I have given first, I have noted that she has gone through so many treatments, so many steroids and non steroidal anti inflammatory medicines, and lots of medications. So, first, I plan to neutralize her body by giving Naxvomica 30, 12 doses every 1 hour for on the first day. So on the next day, I have started Mercor 200 four times a day. Like that, I have given that for four times a day, Mercor for 5 days, and for next 15 days, I have given Saclac. So after the 20 days, she came to me, and most of her 70% of the symptoms got reduced. So then I got to know, yes, she Mercor is the constitutional remedy for her, and to give her much support and intercurrent and miasmatic remedy, I have given tuberculinum 1 m. So from the next 15 days, I gave her Mercor 1 m and tuberculinum 1 m single dose, and Saclac for 15 days. Like that, I have repeated 6 doses in the interval of 15 days. And after 4 months, all her symptoms got reduced, and her colonoscopy also showed the improvement. These are the colonoscopy reports of her before the homeopathic treatment and after homeopathic treatment for 4 months. Here you can see the intestinal mucosa, a granular mucosa with less loss of vascularity and friability and ulcerations, pseudopolyps, everything. And after our homeopathic treatment, we can see a healthy mucosa growing again, and most of her vascularity has also regained. So um, now we can integrating gut brain immune axis with homeopathy. In patients where stress is the trigger, ignitia caliphos works wonders. For digestive irritability, Naxvomica, sulfur, or aloe can be used. For deep immune dysregulation, we consider nosodes like sorinum or tuberculinum, but only after a deep case study. And the lifestyle and diet in IBD, which is very important along with the homeopathic medicines. A diet and the lifestyle plays a major role in treating the patient. While remedies are vital, so are daily habits. Gut friendly diet, emotional journaling, and probiotics and stress management can transform patients' trajectory and encourage patients to actively participate in their healing. So giving the probiotic rich foods, avoiding trigger foods, and giving telling them to do yoga, meditation, and exercises can increase increase their uh, And here comes the summary. To summarize IBD, IBD is not just about inflammation, it's a complex dance between the gut, brain, and the immune system. Homeopathy allows us to approach each element of this triangle with empathy, insight, and the precision. So, here are some of the references from where I have taken the study and I have gone through it. So, thank you everyone for participating here. And now you can please ask your questions. Thank you.
Okay, that's a great session. Excellent view on this. But we do have a lot of time also. We can interact with other persons because it's a hot topic. It's a matter of discussion. We need to have a good matter of good discussion going on in this. So you pointed out of a lot of things. Current trend is skipping breakfast, drinking
Yes.
tea and stimulants, and not getting enough time to exercise, lot of stress in daily routine, and very poor sleep pattern. Everything is causing these things, isn't it, doctor?
Yes, sir.
So you are getting these type of cases in consultation also. Yeah, I
Yes,
think.
sir. Yes, sir. uh, Not even in the ulcerative colitis, in some other autoimmune cases like atopic dermatitis, there also I have seen the gut and the brain involvement which has caused this autoimmune diseases. So it's okay, I can present another case also. So recently, 1 month back, I have seen a girl uh, with autoimmune disease, or that is atopic dermatitis. So all over her cheeks and the elbow joints and the knee joints, she had discoloration and eczema type dry patches. They have started. They first they have comes like red bumps. Then they will develop like a white patch. Then they will spread like a white leukoderma. They appear like leukoderma. So I have taken her complete case. So even after taking the case, first by her constitutional remedy, I have given her pulsatilla because she had so many mental complaints. Like the she was 10 years old, but she is very sensitive. Even if her parents talk to her in a little raisin noise voice, also she will start crying. And if the parent talks to her siblings, then she will feel jealous and she will be like writing in her diary, my parents don't like me, and she used to draw pictures like she's staying away from her and her parents are away, like that. And her mental symptoms are very prominent. She's very sensitive child, and she weeps easily and everything. The pulsatilla, total pulsatilla child. Then I have seen her diet. She don't drink much water. Even one glass of water is very difficult to her to take, and she goes in sun very much. And she used to eat non-veg a lot. And the eggs, per day she used to eat 6 eggs, morning 2, afternoon 2, and in the dinner 2. She want eggs. And lots of sweets. She was craving for sweets and chocolates. So then also I have thought like, okay, pulsatilla, we'll give pulsatilla and we'll see. I have waited for 1 month. I haven't seen much result, but I haven't seen the aggravation also. Then I have asked the mother to give me the case once again. Then she have noted me another important point, that this girl, since her childhood, she had a itching in her anus. Then I got to know that if she have worms in her stomach, her gut is not healthy. That's why how much medicine we are giving, it's not working at all. So first then I have shifted to Sina and every warm remedies I have given. Then I have seen after 1 month the progress has started. So then I have stopped the pulsatilla. Then I have seen everything in her case. Then I got to know natromure was the remedy. And after giving natromure for one next 15 days, then I have seen her white patches on her face, and they started to merge with the another rest of the skin, and her warmth and her itching also got reduced. And by the maintaining cause was those worms. As the worms got uh, what we say, the worms get away from her intestines, her growth also, her recovery started. Now almost in 100%, 60% has cured, another 40% have to be cured. So like this.
Excellent. It's a nice way of interfering this case, and you reached the case through
Yeah.
the whole constitutional approach itself,
Yes.
collected the whole symptoms,
Yes.
the heights minimum you tried to administer. But I have just a simple suggestion. Might
Okay.
be it's an EPIS case, and the chronic might be natriumur. And natriumur was the correct medicine which you prescribed, and it got better. That's a great thing. But you first started it with Pulsatilla. That was also a great thing.
Okay.
You tried to collect all these things, and the jealous, envious nature will point to calcareous salt, Fepis likewise. And while rapidizing, we will get a lot of other medicines also. That's
Yes.
good. Great. So another any other case to just mention? Just a good one. Another one.
Another one is a psoriasis case. So this is also a female. She is about 25 years old now, but since 7 years of her age, she developed psoriasis because her mother has psoriasis. She also got the psoriasis in her, and her mother has tuberculosis also, and they have tubercular diathesis in their body. So since 7 years till 25th year of her age, she has done all the treatments: allopathy, homeopathy, ayurveda, unani, and everything. But also no progress can be seen. But after coming to homeopathy, by seeing her case and her life space investigation, I have come to know that her she is very lazy person, and she baths only in once in 4 days, and she is very intelligent and a topper in her class in everywhere, but she is very lazy to study also. But anyhow, when she studies, she get it very nicely, and she has a very good she has scored very good marks. So she by looking at her, her skin looks very unhealthy. And coming to her food habits, she eats more fried food, cheesy food. She likes very much cheese, and what we say, this fast foods like pizza, burger, everything. And she likes coffee very much, and lots of non-vegetarian foods. She is fond of very much non-vegetarian foods, and she has very sedentary life. By looking at her, we can say this is a sulfur patient. So first, she had lots of suppressed feelings mentally. She suppresses everything. She has lots of anger and emotions also. She don't cry out, but she suppresses everything inside. She don't show her anger, she don't show her emotions, anything. She just be neutral, and she'll be like lazy. She was like, whatever this world wants to do, let them do, I'll be in my place, like that. So everything which she is going through since 7 years, she had lot of impact in her head, like when attending in any functions and all, if somebody sees at her infection like the psoriasis, they will ask and they will point out that all mental stress and trauma she has kept inside her head. So by suppressing this much of grief and everything, and by looking at her skin, I have given her sulfur only, sulfur 1 m once a month, and saclac. And after 6 months, I have seen 50% of improvement,
That's
and
great.
yet to be seen. Here also, her gut and her food habits, lifestyle, and her mental symptoms, they have interlinked and caused this autoimmune psoriasis problem.
Okay, it's time to interact with the other persons, and before I think persons are still warming up. So another thing I need to ask you, doctor,
Yes.
is nowadays always we know uh, everywhere persons are aware that we do have good microbiomes after birth itself. We have a good pair of microbiome from our mother's vaginal cavity itself. We are getting during the delivery time itself. We are getting the first batch of good microbiomes.
Yes.
But due to the life and the lifestyle, not only the lifestyle, lot of antibiotic treatments, chemical medicines, everything is disrupting the environment, good environment inside our gut, and making it bad microbiomes growing in. So our medicines, if we are giving, it will alter, it will try to maintain the thing, but we need to add something also. We need to remove the maintaining cause or any obstacles to cure if there is. We need
Yes.
to change, and we need to have some good diet which is having more probiotic stuff. You just point out that, but can you explain a little bit more if you can, please?
So in this case, to maintain the microbiome inside our gut, we have to give a constitutional remedy. It will help our body, it will support our body, but our body itself have to create that flora and fauna inside our gut. So for that, diet plays a major role. So for that patient, according to her diet, if they are vegetarian or non-vegetarian or vegan, according to their food habits, we have to design a special personalized diet for every patient, and we have to give a prebiotic and probiotic along with the uh, major meals. And we have to stop the maintaining, if they are taking alcohol or this tea, coffee, and caffeines, we have to tell them to stop that, and we have to replace them, because if a person has a habit to take tea, he can't stop it. So if he stops immediately, he will get headaches or anything. So we have to give a alternate to that also, like chamomile tea or cinnamon tea, like that we have to alter them. Then we have to give a probiotic and prebiotic to their meals, and the meal also should be like the plate should be designed like a limited amount of carbs and more amount of fiber and protein and salads. If they follow like this for even 20 days, their gut health will improve a lot. And as the gut improves, everything will get improved, and it will help 50% of this help in our recovery journey, so that we can get the cure very fast.
That's great. Yes. So we need a lot of probiotic and prebiotic food, and also you mentioned some fiber diet also.
Yes,
Fiber,
sir. Yes, sir.
yeah, fiber is very much
Fiber
needed.
is very, very much needed, sir.
Needed. And while taking the session, you mentioned about the importance of yoga, meditation, and exercise. That's
Yes.
also
Yes.
is needed.
Yes, sir. The proper blood supply to our whole body is very important. While we eat our food and we have to digest it, for that we have to increase our digestive fire. that digestive fire is very important for what we eat. Even though we eat everything good, if we don't have the proper digestive fire and the proper blood supply to all our organs, it will not get the proper digestion, it will not absorb the proper vitamins and nutrients from the food. They will pass out like from a tube to tube. For that this gut bacteria and the digestive fire, everything this helps like what we say, the army of our body.
Okay. Another curious thing you pointed out is never drink cold water. Whenever our body is in a warm stage, if you are drinking suddenly cold water, it will be very appeasing. It will be great
Yeah.
for our mind, but
Yes.
the thing is, it will harm our intestine. The immune system will go down.
Yes, sir.
That's
Absolutely.
also a very nice thing which
Yes,
you
sir.
pointed out.
Yes, sir. For actually, we have HCl in our stomach, which is very hot and which is very acidic in nature. If we pour very cold drinks and all, this very cold form and the very hot, this will produce a bang inside our stomach. Then it will cause ulcers and everything. So by drinking the we should, I think it will be good if we drink warm water than normal water also. It will help to increase our digestive fire.
Okay, the other thing, very curious and very funny thing which I read in some book is whenever we are having some poor microbiome in our system, we are culturing it, or it's being cultured in our intestine. That microbiomes itself will ask for this easy sugar, these ice creams, and whenever so I will ask always joke to my patients that if a child is very fond of ice cream, I'll say to the mother that he's having poor microbiome in his stomach, and that microbiome is asking ice cream, not him. So
Yes.
don't feel like that. Likewise, I will save the child, and if we can change the pattern of the microbiome itself, this craving will also vanish, isn't it?
Yes.
Or yeah, as a homeopath, we can change that attitude also with correct constitutional medicine. It's an additional boon for us, isn't it?
Yes, sir. There is a lot of study we can do, lot of research we can do in this field. There is lot of thing to be learned and to be experienced and to explore, actually. So, but if, as you have said, the child, they will crave for sweets and all because of the flora in her intestine. We can alter, we can trick them with like they will ask for chocolates and sweets. We can give a sweetened curd as a sweet, so that with the curd the gut bacteria will get a probiotic nature environment also, and the sweet craving also will get over. Like that we can train our children to be in a healthy path by not taking chocolates and all.
Okay, lot of persons, we are just interacting, and all can join. Dr. Ajni Malayikan, a great person to speak on this. Let me welcome you, doctor, please.
Actually, I joined very late. I heard only one case, I think. I now I don't have anything to ask.
Our doctor pointed out the importance of sleep, and nowadays youngsters are all studying late in the night,
Yes,
getting
sir.
very little sleep.
Yes.
Sometimes they will compensate by waking late, but usually it is not possible because they need to rush up to the classes and all. So they
Yes.
are just sleeping in a very limited time only,
Yes.
and that also is causing uh, problems, isn't it?
Yes, sir, definitely. The body needs a proper 7 to 8 hours sleep per day, because throughout the day it works a lot like a machine. So even if we can't give a 7 hour break to it, our body needs to get recovery also. our organs get to detox and to get recovery and to restart again, we need a deep sleep of 7 hours. But in this generation, as everyone are very busy and everyone has lots of work to do, we don't get a proper sleep of even 5 hours. uh, this is the main cause because of which we are getting so many lifestyle diseases these days than our elders, than our ancestors. The lots of lifestyle diseases like diabetes or hypertension and PCOD in women, they are all increasing day by day because of our unhealthy lifestyles only.
So we need to correct the unhealthy lifestyle also, because these
Yes.
are all these obstacles to cure itself, and so we
Yes.
need to correct that also along with this
Yes.
selection of medicine,
Yes,
isn't
sir.
it? So we are having Dr. Mohammed Saidan with us. Please. Doctor? Yeah.
Am I audible, please?
Yes,
Yes,
sir.
yes.
Yeah, thank you very much. Thank you very much, ma'am. It is well-prepared presentation.
Thank you,
And
sir.
actually, GI disturbances are the root cause of all diseases, as you know.
Yes,
Yeah,
sir.
you can mention whatever you want. Say about Parkinson's, multiple sclerosis, diabetes, any of those neurodegenerative or autoimmune disease should have a root cause in the GI.
Yes,
Accept?
sir. Yes, sir.
Yeah,
Yes, sir.
yes.
Definitely.
My question is, and actually we should start treating those cases through the GI. GI study should be preceding all the treatment. My question is, for
Yes.
the psoriasis cases, did you notice some GI disturbances on that patient?
Yes, sir. Yes, sir. She
Yeah.
had frequent diarrheas.
Yes.
Yes, sir. And sometimes she had alternative after the diarrhea has subsided and constipation starts.
Yes,
Yes, sir. Like
actually, yes, and I did see some of our patients like that, as in GI expressed and GI manifested, but as the root cause is the GI.
yes, sir.
Thank you very much, ma'am.
Thank you for your. Yes, sir.
So anyone need to interact with the speaker? You can raise your hand that I can welcome you. Dr. Ram Pravesh Shah.
Thank you, Dr. Bindu Raj and everyone. Namaskar.
Namaste, sir.
Congratulations, Dr. Fatma Zehra.
Thank you, sir. Thank you.
Very nice presentation relation to stomach to mind, inflammatory bowel disease.
Yes.
Main depend 90% case serotonin, mind guide mental or stomach deals रिलेशनशिप. ऐसे भी हिंदी में कहा जाता है पेट साफ तो बीमारी माफ.
जी बिल्कुल.
तो मेन कॉज ऑफ डिजीज इमोशनल और बैकग्राउंड ऑफ सोरा
Yes, sir.
थिंकिंग पॉजिटिव थिंकिंग इमोशनल एंगर ग्रीफ सदमा anger, grief, anxiety, etc. Emotional cause. Emotional cause after disturb digestive system. A digestive system disturb mind. So mind is the very important or background of Sura. So, role of constipation, diarrhea, gas information, and disturb of microbiota, good bacteria is the disturb due to due to take the bad thinking and bad food, etc. So, my inflammatory bowel disease, fiber, take the fiber food,
Yes, sir.
and indisposition disease, maintenance cause.
Yes, sir.
Maintenance cause is the very role, maintenance cause. So, there are three information, CNSA, ENSA, and vagus nerve is the very role
Yes,
of
sir.
stomach to brain. So, very thanks, डॉक्टर फातिमा ज़ेहरा। और
you, sir.
कहा भी गया है, काम में बात कफ लोभ अपारा, हिंदी में शास्त्र में लिखा हुआ है, काम में बात कफ लोभ अपारा, क्रोध पित्त नित छाती जा रहा। यानी एंगर से डाइजेस्टिव सिस्टम खराब होता है और छाती को जलाता है, गैस फॉर्मेशन होता है, और छाती जब जलता है तो ब्रेन जो है डिस्टर्ब होता है। तो वेरी थैंक्स डॉक्टर फातिमा, थैंक यू। पाकिस्तान।
Excellent introduction, Dr.
Salam
Rampravesh sir. Thank you. Thanks a lot. And next is Dr. Shaila. Doctor, you can speak.
Doctor, according to your opinion, what are the causes and diet and regimen for IBS?
Okay. The main causes for IBS are first of all the lifestyle disorders, the lifestyle bad lifestyle, and the genetic factors and the environmental factors. The genetic factors, which include like if they have a genetic history of ulcerative colitis, they will get a ulcerative colitis, and the stress, depression, and anxiety, and the bad food habits, and what we say another cause for ulcerative colitis are eating a large amount of spicy foods, and not maintaining good gut bacteria. This will increase ulcerative colitis. And the causes, and can you please repeat the question, ma'am?
Diet and regimen for
Diet.
IBS.
Yes, ma'am. For diet and regimen for the ulcerative colitis was they have to take lots of fiber food and less dietary foods. Dietary food and non-veg, and mainly the red meat. They have to eliminate the red meat totally from their life, and they don't have to take dietary products and bakery items, all breads and all, and nuts also. They have to limit taking nuts, but by taking lots of fiber food and good probiotics, they can increase their ulcerative colitis. They can increase their what we say gut bacteria, good gut bacteria.
Good. And the other thing is we need to.
Thank you, Doctor, for a nice presentation.
Thank you, Dr. Shaila. And I think we need to add another thing also. I am mentioning you also stress the importance of the fiber diet, and we should not forget the importance of millets and to avoid this gluten wheat diet for this. They are all irritants, wheat and other gluten diet.
Yes, sir.
Isn't it?
Yes,
so,
sir.
Millets is now a trend. In our place, millets, all persons know the importance of millets.
Yes, sir. Actually, we can take a proper fiber-rich diet, like by reducing the carbs and gluten in our food. We can take the alternative like quinoa and millets a lot, and we can make every food with the help of millets. Like even the idli and dosa also we can make with the help of millets nowadays. So we can add a little bit of quinoa in our or millets in our plate, and lots of steamed vegetables or sauteed vegetables, and some amount of good protein, like not taking protein in red meat form. We can take like paneer or the chicken breast, just steamed chicken breast. It will not be so much problem to digest. It will digest easily than compared to the red meat. uh, we can take the protein through eggs also, and we can add a little amount of salad, and some we can also take seeds, all these five types of seeds, like flax seeds and sunflower seeds, pumpkin seeds, and watermelon seeds. And we can add nuts also, like badam and walnuts and pistachio, like that. We can mix everything, and we can take 2 spoons per meal, so we can get some amount of protein through that also. So by eliminating the gluten and the rice and the carbs, we can have like this meal 2 or 3 times a day. It will be much enough for regulating our UC and Crohn's disease patients' diet.
Okay, that's great. And you're a very learned doctor, having a good type of knowledge on these things. And initially, while starting the session itself, you told that this subject is very close to your heart, and we are
Yes.
getting that feel. You are
Yes.
very much proficient and learned, and every aspect you covered. And
Thank
we
you.
can elaborate all these things. All persons sitting here do have a lot of knowledge about these things, and we can elaborate all these things in detail again. But
Yes.
I think the time is now going. We need to just, yeah, 3 more minutes. Dr. Muhammad Saidan need to talk. I think he can make it in a minute. Please.
Yeah, it would be very short. Thank you, sir. For Dr. Shaila, in the clinic where I have attended, we have found 80%, 80 to 90% of the patient of ulcerative colitis and GI disturbances are the chronic stress.
Yes, sir.
If you investigate your patients, you will find past and recent stress over years, and they cannot solve their problems, whether it's socially or financially or whatever the cause, the problem is. Actually, they are under stress, but they cannot tolerate the stress, and this will express on the GI disturbances. Actually, 80% of our patients that on the clinic I have attended like that. Thank you.
Yes, sir. Absolutely correct, sir. I have
Thank
seen
you,
this
sir.
chronic.
Thank you, ma'am.
Yes, sir. You're welcome.
Thank you, Dr. KANEEZ Fatma Zehra, for presenting
Well,
this session. On behalf of
thank you.
IFPH, I thank you, and I thank all who were presented in this session. And it's time to start regional session in Malayalam. Over to Dr. Shaila.
Thank you, sir.